Hi, this is Dr. Kormeili. I want to discuss with you what a skin biopsy is. Skin biopsy is a removal of a piece of either a bigger lesion or a spot on the skin, or taking what we could see with just the naked eye. The most important thing to understand about a biopsy is that it's done for diagnostic purposes. That means we do it to find out what the spot really is under the microscope. It's not meant as a treatment. So, for example, if we were to take a biopsy of a skin spot and look under the microscope and we find that it's a skin cancer, we actually have to go back and do a treatment. Depending on what type of cancer, what type of cells, where the location is on the body, we have a variety of different treatments that we can use depending on the patient's preference to be able to take care of that skin cancer. But the most important part to start off with is to find out what it is that we're looking at under the microscope. A skin biopsy is done with just cleaning the skin, putting a tiny amount of a numbing medication, lidocaine most commonly, right underneath the spot and getting that spot to fall asleep or to get numbed. Once that happens, we can take a blade and take a piece of that spot, or if it's tiny, usually the whole spot, put it into a bottle. The bottle goes to a pathologist, gets converted into a slide, and then can be visualized under the microscope for a proper diagnosis. The spot on the patient obviously will bleed because most patients are alive. So what we need to do is stop the bleeding, put a Band-Aid, and we'll give you care instructions, but most importantly to keep it clean and dry and to put an ointment so it doesn't get too dried up and crusted and it heals appropriately. Of course, with anything that we do on the skin, we advise you not to get a lot of UV radiation or sun and to keep it protected from any contaminated waters like ocean, jacuzzi, or a swimming pool. But running water in a shower is just fine. So I'm going to show you how a skin biopsy is done. So in this spot, we've already gone ahead and marked it with a pen so we don't lose the margins and it's easier for you to see once it's numbed up. So this is the lidocaine. I like to bend my needle because I like to keep it at the level of tissue that I actually like to cut. So here we go right around the spot, a tiny little poke, and it forms what we call a bleb. And the skin turns white in response to the numbing. And in just a few seconds, the skin will be completely asleep and we can remove our biopsy from that area. Now the skin is numb, we're going to go ahead and use a blade and we're going to cut, and you see, just superficially take a piece of the skin. There's no stitches needed for this one. Now that we remove the piece of skin, we're going to just control the bleeding using a hyphocator, just a slight amount of energy, just like that. And of course, the patient doesn't feel anything because it's completely numb. And then the next step is to put some ointment and a Band-Aid, and the specimen goes into a bottle, and this sent to the lab to be turned into a microscope to be able to look under the microscope, visualize, and come up with a diagnosis. It's that easy.